There's a difference between helping people that are at high risk, and that would be wonderful to do that at the end of this month or December. But in terms of tamping down the pandemic and this very disturbing second wave we're seeing, when do you think that the vaccine could actually be used to make a difference there? Seems like much later, sometime next year or mid-next year. Am I wrong on that timeline?
I think you're a bit off on that timeline. Okay. Obviously, it's all dependent on the FDA review process, and it's going to be, as it has been throughout, by the book. But we have contracted with Pfizer for 100 million doses, and that'll start rolling to us 20 million a month starting the end of this month. Pfizer's projected approximately 40 million doses by the end of this year. We will have to look at the data and look at those core target groups, but be thinking the most vulnerable, your elderly in nursing homes, assisted living, and then be thinking your healthcare workers and your first responders as those core initial groups that we've received recommendations to focus on. Try to get them vaccinated according to whatever the data provides on Pfizer, and if we get Moderna to come in the next couple of weeks, we'd have that in our toolkit also. So we've said that we would have enough by the end of this year to vaccinate all of the most vulnerable, by the end of January to vaccinate all senior citizens as well as first responders and healthcare workers, and then by the end of March, early April, enough across all of our vaccine portfolio to have for every American who would like to be vaccinated. Yeah. That's the timeline we're working from. The particulars are going to depend on seeing that data and just seeing where does it look most effective, which population is it most effective and safe in.
It's great news. It's a tribute to the private sector and to our scientists and to the Trump administration in terms of Operation Warp Speed, faster than it's ever been done before. It's phenomenal. But Pfizer seems to be taking great pains to say, well, they signed on to Operation Warp Speed but never took any money. Have you seen that? Is that they're parsing that? I don't know why it's important to them that they distinguish not being part of it. Maybe they're worried about being tainted with political, that it was rushed or whatever the controversy surrounding vaccines are. But they didn't take any money, but were they part of Operation Warp Speed, Mr. Secretary? Yeah, so they actually corrected that statement during the day yesterday. I don't know why they made that originally. I've got a $2 billion contract for 100 million doses and an option for 500 million more that says they're very much part of Operation Warp Speed. We assisted them with ingredients. We're assisting them with distribution, syringes, needles, dry ice for shipment, distribution, planning. Oh, no, they're very much part of Operation Warp Speed. Andrew.
Mr. Secretary, I don't know if you saw Governor Cuomo's comments yesterday, but I want to read you a line. He said there's good news here, clearly, with the development on the vaccine. But then he says the bad news is it's about 2 months before Joe Biden takes over, and that means this administration will be implementing the vaccine plan. They're going to take this vaccine, and they're going to go through the private mechanisms, through hospitals, through drug market chains. That's going to be slow, and they're going to be bypassing communities we call health care deserts. If you don't have a Rite Aid or a CVS, you're in trouble. What's your reaction to that? First,
his statements are unconscionable in terms of suggesting that politics should be a reason for delaying Americans' access to vaccine. Second, the governors are actually in charge of the distribution of this vaccine under our plans. They will determine where it's distributed to and the mechanisms that they want to use to vaccinate people. That is what we've been working with all of our governors on. We have actually the plan from New York, which Howard Zucker, who I worked with in the Bush administration, is his health commissioner. They've got a fine plan. We've got an excellent relationship with them. The governor is in charge of distribution in his state. It'd be helpful if he would actually read his own plan and speak with Dr. Zucker to learn what it is.
Mr. Secretary, we also heard about from Eli Lilly today, emergency use authorization for their antibody product. And just some sticky issues came up, and we're trying to figure out exactly. I wouldn't want to be in the shoes of the government on how to distribute this. It's initially going to be for high-risk people that don't have real serious symptoms yet, almost prophylactically, but they need to go into the hospital to get the infusion. But theoretically, anybody that gets COVID could benefit from this. And we're wondering whether there's going to be, for lack of a better term, people jumping the line with money, with their status, whatever, to get access to this. And conversely, where people that typically have trouble getting any type of health care, they don't have a chance in hell of getting this if they could use it. How do you make sure that it's rationed fairly and to have the greatest effect.
Yeah, we had exactly the same concerns with Gilead's remdesivir when it came out originally and was in more limited supply. And we're going to follow the exact same mechanism we used with that in terms of distribution, because we want to make sure that this product is available, especially for underserved hospitals, underserved individuals. So what we're doing is we'll allocate this based on hospitalization and disease burden around the country, and the governors will actually tell us where they would like product to be shipped to ensure equitable distribution. Now, initially, the initial shipments will go to hospitals because they have the infusion capabilities to set this up for outpatient individuals who have tested positive. But we're going to be launching and exploring with Lilly other types of infusion capabilities, outpatient infusion centers, other forms of administration. And of course, Lilly and Regeneron are both also studying the use of this product through what's called a subcutaneous injection, a needle injection rather than an infusion. So we'll follow that process. We'll ensure equitable distribution, and we'll work tightly with our governors as we did on remdesivir.
Shepard Smith here. Thanks for watching CNBC on YouTube.